Hello everyone, this is Dr. Chandana, consultant surgical oncologist from American Oncology Institute, Guntur. Today I am here to discuss about colorectal cancers. This is one of the common cancers we see in our practice, but it is less discussed and even the patients are hesitant. They have their inhibitions to discuss regarding colorectal cancer. Colorectal symptoms initially, resulting in delayed presentation, which will decrease the survivals related to the colorectal cancer. Coming to the risk factors, usually colorectal cancers are seen in patients more than 50 years of age, but it can present at an earlier age also. In India, we are seeing 30-year-old patients with colorectal cancers also. Both male and female are at risk for this cancer. Smoking is one of the major risk factor, and in addition to it, alcohol and our sedentary lifestyle, obesity, like high fat diet and low fiber diet, red meat, all these are risk factors for colorectal cancer. Coming to the symptoms of colorectal cancer, we divide the colon into right colon and left colon, and the symptoms also vary according to it. The right colon, they usually present with blood in stools, black colored stools, and sometimes they even present with no specific symptom except for fatigue because of occult blood loss, presenting as fatigue. For left-sided colon cancers, they usually present with obstruction. It's not identified early and they present in obstruction to us. For rectal cancers, we usually see blood in stools or mucus stools. It is usually alteration in bowel habit. They can present with severe constipation or they can also present with diarrhea. They have to go for stools multiple times in a day. So whenever there are changes in the stool habits, it's better to consult a colorectal surgeon or oncologist, get a diagnosis. To confirm the disease, we usually do a per-rectal examination followed by colonoscopy and biopsy. To stage the disease, to see whether it has spread to any other organ, we go for whole body PET scan or CT scan. Coming to the treatment, surgery is the mainstay of treatment for this disease. For colon cancers, it is usually hemicolectomy. For the right side, it is right hemicolectomy. Left side, it's left hemicolectomy. For rectal cancers, we usually give neoadjuvant treatment. That is, we give chemoradiation before surgery, and then we go for surgery. Surgery being, we call it anterior resection of rectum. And when the disease is involving the sphincter muscles, which help in controlling the stool, if it is involved, we go for resection of the sphincter, that is abdominoperineal resection of rectum with permanent stoma. Nowadays, recent techniques of laparoscopic and robotic resections are available. At AOI, we do laparoscopic hemicolectomies and laparoscopic rectal resections. With laparoscopy, there is advantage over open. The incision size is decreased. With this, the patient will have lesser pain, earlier recovery, lesser blood loss, earlier mobility, early discharge. So at AOI, we are doing laparoscopic resections. In this, we mobilize the tumor area and using a laparoscope with a small incision, and we divide the tumor followed by joining of the normal bowel with newer technology of using staplers, which helps in earlier recovery of the bowel. If you are having constipation or any altered bowel habits, please feel free and consult a colorectal surgeon at the earliest.